Sitting is today's smoking. That's a quote that is used in today's medical community, and the reason why is because people are sitting so much. It actually contributes to problems like low back pain, cardiovascular problems, and more. Mike, you want to add in?
Including hip pain, which can be very stiff hips, and if you have limited mobility, it's going to affect your lifestyle and what you can actually do.
So first, we're going to show you why and how sitting makes your hips stiff.
Steps! And then we're going to get into five simple...
Your hips stiff, and then, Mike, what are we going to show them?
We're going to get into 5 simple stretches you can do to help solve this problem.
But before we go any further, I'm going to learn how to speak, and then we'll carry on with this video.
Stiff hips.
Okay, we're going to use Sam here to show you how these muscles get tight, why they get tight, and then why we're showing you this, or how the stretches actually correct the problem. So in the seated position, the hip is flexed at 90 degrees. So here we have the hip flexed at 90 degrees with Sam. Now this red kinesio tape, it happens to be rock tape. We just have that handy in the studio. These muscles will actually tighten up because that's the position, the seated position is for such a long time. Now, when this person stands up, let's look what happens after the muscle tightens up. We're going to focus right here. When you stand, you can see the muscle actually stretches and is pulling, and that can rotate the pelvis forward, as well as some of the muscle fibers go to the low back, and they pull and can hyper or put stressful extension forces on the low back. Either way, we have this rotational and these forces on the low back because of this tight hip muscle group. It's the iliopsoas. You don't have to remember that. But there's one more particular muscle that has the same type of problem that is oftentimes forgotten about with the stretch, and we do not forget that with our program, and that is the rectus femoris muscle. It's a long muscle from the ilium, the iliac crest. They call it the ASIS. We won't get into that. It goes down across. It's actually one of your
quad muscles.
Quad muscles. Thank you, Mike. Now, that muscle also tightens up when in seated position, and then when you stand, you can see it pulls out here on the ASIS that we mentioned, and that also rotates the pelvis in a position we really don't want to have it in. So stretch out these two muscles, and you can take that force off the back and the hips, and life is much better. So let's get to it. Good job, Sam. Thank you for not saying anything, Mike, except for what you did.